Longitudinal research in the Americas and Europe has connected increased consumption of ultra-processed foods to a variety of health hazards, including obesity, high blood pressure, type 2 diabetes, and dementia. Other studies in Spain and France have connected ultra-processed foods to an increased risk of premature death. Here, we'll look at how to tell if a food is ultra-processed. Are you concerned about the quality of your snack options? According to research, Americans prefer ultra-processed foods. While these quick, easy-to-grab solutions are perfect for fast-paced lifestyles, they have been linked to health risks. A diet high in ultra-processed foods has been linked to an increased risk of metabolic syndrome, type 2 diabetes, and several malignancies. The United Nations Food and Agriculture Organization, FAO, defines ultra-processed as ingredient formulations that are primarily intended for industrial use and are typically generated using a variety of industrial techniques and procedures. Additives are commonly used in ultra-processed meals to make them more sellable, palatable, and, in many cases, hyper-palatable. Ultra-processed foods are those that have undergone numerous processes and contain a host of added ingredients, such as preservatives, sweeteners, and thickeners. Ultra-processed foods include packaged cookies, frozen dinners, protein bars, and flavored chips. Most of the foods we eat every day are processed to some degree, but ultra-processed foods take things a step further. Here's how ultra-processed foods affect the body and how to incorporate them into a well-balanced diet. Navigating ultra-processed food choices. According to the FAO, a useful first step in determining whether a product is ultra-processed is to check the ingredient list for components that are not commonly used in kitchen cooking, such as maltodextrin and artificial sweeteners. Ultra-processed foods may also contain ingredients extracted from other foods, like casein, lactose, gluten, whey, hydrogenated oils, protein isolate, maltodextrin, inverted sugar, and high-fructose corn syrup, according to specialists. They also mentioned that these additions could be healthy ingredients such as fiber, vitamins, or minerals. The FAO provided an exercise demonstrating how to distinguish between processed and ultra-processed foods. For example, processed bread will have a simple ingredient list that includes wheat flour, water, salt, and yeast, all of which are common household items. Ultra-processed breads will contain additional ingredients, such as emulsifiers or artificial colors. Many ultra-processed foods look nothing like their original ingredients, such as pastries, cookies, soda, candy, and frozen meals. They typically have long ingredient lists and contain additives, preservatives, and ingredients you would not find in a home kitchen. Unfortunately, food manufacturers are not allowed to indicate on the food label the techniques used to make their products, making it difficult for customers to determine whether their food choice is ultra-processed or not. And while many ultra-processed foods contain a long list of ingredients, this does not necessarily imply that the food is unhealthy. The fortified foods can contain a variety of vitamins and minerals that sound like chemicals but are beneficial to public health, such as folic acid, which helps prevent neural tube defects during pregnancy. In general, keeping track of how many ultra-processed foods you consume is a good idea. The thing emphasizes that consumers may want to limit fried snacks, chips, or highly processed cakes, cookies, and other pastries with added sugar, fats, and sodium. How to find balance with ultra-processed foods. Consuming more ultra-processed foods is associated with specific health hazards. If you want to avoid eating ultra-processed foods, you can do so by reading the labels on your packaged foods. It's worth noting that not all ultra-processed foods are the same. Some ultra-processed foods are also nutrient-dense, meaning they are a source of vitamins, minerals, and other health-promoting components with limited added sugar, sodium, and saturated fat, they noted. They noted that foods such as whole grain cereals and fortified soy milk provide essential nutrients and easily accessible, inexpensive, and, yes, ultra-processed versions. Data supports the idea that ultra-processed foods can benefit a person's health, depending on the choices they make. USDA scientists demonstrated that it is absolutely possible to follow the 2020 to 2025 dietary guidelines for Americans while consuming 91% of total calories from ultra-processed foods. The researchers selected selections that were low in saturated fat and added sugar, as well as micronutrient-rich options. This menu featured ultra-processed goods such as quick oatmeal, ultra-filtered milk, whole wheat bread, and dried fruit. Researchers discovered that adopting this dietary pattern allowed people to achieve all healthy eating standards, with the exception of exceeding the required sodium intake and failing to meet the recommended whole grain intake. This evidence demonstrates that, while eating a diet primarily composed of ultra-processed foods is not suggested, it is feasible to make choices within the ultra-processed category that will benefit your health. Garone, a scientist, emphasized that there is no ideal ratio for how much ultra-processed food should be included in your diet because everyone's demands vary depending on accessibility and affordability. It won't break your health if you eat an ultra-processed granola bar or ice cream sandwich here or there. The main thing is to identify ultra-processed foods and not rely on them for the bulk of your diet.